Hello friends, I'm Dr. Omar Malik and welcome to another video from Med Simplified. In this video, we will talk about osteoarthritis. Osteoarthritis, also known as degenerative joint disease or degenerative arthritis, is the most common chronic joint condition worldwide. It occurs when the protective cartilage that cushions the ends of your bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects the joints in your hands, knees, hips, and spine. This video on osteoarthritis is a part of a series of videos on joint-related issues that we are trying to educate more people about. You can also check out our other videos in this series like diet for joint pain, rheumatoid arthritis, most common causes of joint pain, etc. So if you haven't watched our previous videos on this topic, click the banner above or the links in the description box down below to watch them after you watch this video. So without further ado, let's begin with our video. A joint is where two bones come together. The ends of these bones are covered with protective tissue called cartilage. Cartilage is a tough, rubbery substance that's flexible and softer than the bone. Its job is to protect the ends of the bone within a joint and to allow them to move easily against each other, which leads to smooth movement of the joints and also helps the joints in bearing your own body weight. With osteoarthritis, this cartilage breaks down. These bone surfaces become pitted and rough. This can cause pain within the joint and irritation in the surrounding tissues. Damaged cartilage can't repair itself. This is because cartilage doesn't contain any blood vessels. When cartilage wears away completely, the cushioning buffer that it provides decreases, allowing for bone-to-bone contact. This leads to pain, stiffness, and other symptoms associated with osteoarthritis. Osteoarthritis occurs most commonly in older population, although it can occur in adults of any age and is a leading cause of disability and affects more than 30 million men and women in the United States alone. Let's begin by understanding how osteoarthritis develops. Well, the most common cause of osteoarthritis is long-term joint damage, and this is the reason why osteoarthritis most commonly occurs in older population. With age, our joints get damaged due to various reasons. This damage can accumulate over time. The older you are, the more wear and tear you have had on your joints. Direct joint damage may also lead to osteoarthritis. This includes factors such as fractures near the joints, joint dislocations, torn cartilages, and ligament injuries. Other causes that can lead to osteoarthritis include joint malformations, obesity, poor posture, family history, and in some cases, gender. Females are usually at a higher risk due to menopausal changes. Osteoarthritis can occur in any joint. However, the most commonly affected areas of the body include the small joints of the hands, fingertips, knees, hips, and spine, typically at the neck or lower back. The most common symptoms of osteoarthritis include pain in the joint, which is usually the presenting symptom. Pain is especially more severe after movements and fatigue of the joint. Pain of osteoarthritis is also more common when the person wakes up in the morning. You can feel certain discomfort when pressing on the area of the joint with your fingers, which is known as joint tenderness. Joints can feel stiff, especially in the morning when you wake up. Inflammation can also be present, which basically means your joints become tender, red, and swollen. As osteoarthritis becomes more advanced, pain associated with it becomes more intense. Over time, swelling in the joint and surrounding area may also occur. Recognizing the early symptoms of osteoarthritis can help you to better manage this condition. As the disease progresses in severity, other symptoms may also develop, such as increased swelling and inflammation of the joint. Normally, Synovial fluid acts as a lubricant-like barrier which helps to reduce friction during movement in the joint. However, in osteoarthritis, it accumulates in larger amounts and can cause joint swelling. Fragments of broken off cartilage may also float within the synovial fluid, causing increased pain and swelling. You can also feel intense pain which increases over time. You may feel pain during activities, but also when you are at rest. You may feel an increase in your pain level as the day progresses, or more swelling in your joints if you have used them a lot throughout the day. You can also experience decreased range of motion of the joints involved. You may not be able to move the involved joint easily due to stiffness or pain in your joints. This can make it harder to do day-to-day activities. As the joint continues to wear down, muscle weakness, bone spurs, and joint deformity may also develop. Nerve involvement can also occur, especially if your spine is involved. There may be associated neural symptoms such as weakness, numbness, and tingling and shooting pain depending upon the nerve root involved. The joint damage caused by severe osteoarthritis is irreversible, but treatment can help to reduce the symptoms. In one of our previous videos, we discussed about rheumatoid arthritis. Although both osteoarthritis and rheumatoid arthritis affect the joint and present with pain and swelling, these are entirely different diseases. Osteoarthritis is a degenerative condition, which basically means that it increases in severity over time. Rheumatoid arthritis, on the other hand, is an autoimmune disorder. People with rheumatoid arthritis have immune system that mistakenly damages the soft lining around the joints. As the immune system damages the joints, fluid buildup within the joint occurs, causing stiffness, pain, swelling, and inflammation. To know more about rheumatoid arthritis, watch our video by clicking the banner above. If you're not sure which form of arthritis you have, your best bet is to talk to your doctor. Your doctor can easily diagnose the appropriate condition and help you to manage it in a better way. Osteoarthritis is often a slow developing disease that can be hard to diagnose until it starts to cause pain or debilitating symptoms. Although your clinician can diagnose osteoarthritis by just examining your body and taking a detailed history, he may use imaging and other tests to confirm the diagnosis. In addition to X-rays, your doctor may use an MRI scan to diagnose osteoarthritis. This imaging test uses radio waves and a magnetic field to create images of bone and soft tissue and has the highest diagnostic capability. Other diagnostic tests include a blood test to rule out other conditions that can cause joint pain, such as rheumatoid arthritis or infections. A joint fluid analysis can also be used to determine whether gout or infection is the underlying cause of inflammation. Osteoarthritis treatment is centered upon symptom management. The type of treatment that will help you the most will largely be determined by the severity of the symptoms and their location. Often, lifestyle changes, over-the-counter medications, and home remedies will be enough to provide you with relief from pain, stiffness, and swelling. At-home treatments and lifestyle changes for osteoarthritis include regular exercise, weight management, adequate sleep, and heat and cold therapy for the joints. Physical activity strengthens the muscles around your joints and helps to relieve stiffness. Aim for at least 20 to 30 minutes of physical movement at least every other day. Choose gentle, low-impact activities such as walking or swimming. Stretching exercises and yoga can also improve joint flexibility and help with pain management. Being overweight can put a strain on your joints and can cause pain. Shedding excess pounds helps to relieve this pressure and reduces pain. A healthy weight can also lower your risk of other health problems such as diabetes and heart diseases. Resting your muscles can reduce swelling and inflammation. Getting enough sleep at night can also help you to manage pain more effectively. You can experiment with heat or cold therapy to relieve muscle pain and stiffness. Apply a cold or hot compress to sore joints for 15 to 20 minutes several times a day. Gentle stretching exercises can be very helpful for people with osteoarthritis, especially if you have stiffness or pain in your knees, hips, or back. Stretching can help improve mobility and range of motion in the joints. As with any exercise plan, check with your doctor before beginning to make sure it's the right course of action for you. I will leave links to some of the videos which specifically talk about exercises for people with osteoarthritis in the description box down below, so make sure to check them out. Now let's look at the various medications that are used to treat osteoarthritis. There are a number of medications that can help to provide relief from pain and swelling that occurs in osteoarthritis. They include oral painkillers like Tylenol, which contains Acetaminophen. Topical painkillers are also very commonly used, which are over-the-counter products and are available as creams, gels, and patches. They help to numb the joint area and can provide pain relief, especially for mild arthritis. Non-steroidal anti-inflammatory drugs are most commonly used for managing the pain and swelling in osteoarthritis. These include drugs such as Advil, which contains Ibuprofen, Aleve containing naproxen, and several other drugs. Antidepressant drugs in low doses are also used in osteoarthritis. Most commonly, duloxetine is used, which increases the pain threshold of the patient. Steroids like prednisone are also used in cases of severe osteoarthritis. This medication is available in oral form. They may also be given by injecting directly into the joint. Your doctor may also recommend braces and supports in case of spine or severe knee involvement. In some cases, surgery such as knee replacement or hip replacement may also be required in case of very severe disease. With this, we come to the end of this video. In our upcoming videos, we'll be telling you how to manage osteoarthritis naturally. If you want to know the best diet for joint pain, watch our video on the topic by clicking the banner above. We at Med Simplified are committed to bringing you the latest and updated content. You can support us by spreading the word and sharing our videos to your friends and family. Also, you can become a member of our YouTube channel or support us on Patreon. All the links are in the description below. Thank you so much for watching and see you in the next video.